Hello, I'm Dr. Daniel Farkas, DC, and I'm a certified functional medicine practitioner, and I'm here to talk to you today about anxiety and adrenal fatigue and how to combat them. I am unfortunately familiar with both of these conditions, and I feel that I've come up with a pretty effective way to assess and fight them, and I hope it works for you. So let's get started. Well, the problem is anxiety, and anxiety can require a multifaceted approach for success. Now, a critical component that requiring a focused treatment protocol is the oftentimes frustrating adrenal fatigue syndrome, which actually has 5 phases. Now, adrenal fatigue compounds the symptoms of anxiety, and when the mind burns out the body's stress management system, adrenal fatigue is born. So the causes for anxiety, of course, classically would be mental stress and or poor or irregular diet and sleep, yes, of course. But what I want to talk about is what actually happens to the body systems that get affected by anxiety and what causes the subsequent adrenal dysfunction. Now, the answer to this is what occurs is dysfunction. Things just don't work right, just as we mentioned. And this causes out of control cortisol levels that create a roller coaster of emotions due to wild cortisol and blood sugar fluctuations. Cortisol and blood sugar, they work together. When cortisol is high, blood sugar is low. When blood sugar is high, cortisol goes low. But they should be balanced. Cortisol should be really high in the morning, about 6 a.m., and by 9 a.m. it should be low. Blood sugar starts off low in the morning, and by 9 a.m. blood sugar should be high and steady. But when the adrenals dysfunction, the cortisol can pull the blood sugar all over the place and give us those horrible feelings of anxiety. To me, the feeling of anxiety or an anxiety attack is absolute dysregulation of cortisol and blood sugar, and that's from my personal experience. So the traditional means, I gotta say, unfortunately, medical science does not recognize adrenal dysfunction as it's illustrated here. The traditional means of addressing this would be, pharmacology, anti-anxiety medications, antidepressants, sleeping pills, mood stabilizers, et cetera, a lot of side effects. So some people need these things, just to function, to stay alive. I'm definitely not against that, but long-term, sure would be nice to get things back on track. So, it begs a question, what if this stays the same? What if we just kind of treat the symptoms without analyzing the body system's dysfunction and, creating a program to get the adrenals back on track so we can start to feel stable again and then combat the anxiety with other tactics, which we'll talk about here. Again, I say, what if things stay the same? The patient has an uphill struggle with seemingly inevitable setbacks. Adrenal dysfunction is a muddy ditch to get stuck in, and then sometimes the harder you try to get out of it, especially with exercise or fasting type diets, you just go deeper in the ditch. So today I'm glad to share with you an integrative approach utilizing some basic, natural, functional medicine strategies that won't interfere with traditional therapy, or drug therapy regimens, and surprisingly can actually help drug therapies be more effective. So here we're going to go step by step. You see, first off, we have to assess. You got to get the facts. My mantra in my practice is don't guess, test. Don't guess, test. Saliva test to assess for cortisol functionality is simple. Saliva cortisol used to assess for the present functional output of the adrenals and the stability or instability of blood sugar is pretty easy to test. What we do is we get a group of samples of saliva through the course of a day, starting first thing in the morning, just a little bit after waking up. Another saliva sample later in the afternoon, another saliva sample around dinner time, and one before bed. And we use that to chart this curve called the cortisol curve that also tells us everything about what's going on with blood sugar through the day too as well. To just test it just one time during the day by a blood test or saliva test, it's good information, but it's incomplete. That's all like the functional approach, and that's kind of what functional medicine is. It's seeing how things are actually functioning in real time. So once we get these saliva test results, which come back pretty quick, we can determine what phase out of the 5 phases of adrenal fatigue that someone has. And then we can use that to administer herbs at certain times of the day depending on if the cortisol is high or if it's low. If it's high, we're going to give the type of herbs at that time of the day, generally speaking, morning, afternoon, or evening, that will pull that high cortisol back down. If the cortisol is just terribly low, if someone has true adrenal fatigue where the adrenals just aren't outputting anything, we're going to give some herbs that stimulate, that lift those adrenals up just a little bit. And slowly over time, we can pull this curve back to normal. What helps to support this process is a very significant amount of vitamin C. And it's pretty simple to figure out how much vitamin C someone needs. You just give them vitamin C until it loosens up their bowels, and then you back down a little bit. Vitamin D is critical, as well as vitamin B5 and B6 working together. Now, here's a note. B6 toxicity can cause anxiety. A lot of people take a lot of supplements that are heavy in B6. I see vitamins like B6 and vitamin D as very, very serious things to take. Some people say, well, they're water soluble, you can take tons of them. And I say, no, you can get toxic in those still as well. I know from personal experience it can happen. I say, if you're supplementing, just like a medication, you want to retest about every 60 days or so and see where your blood level is. You don't want to get toxic. So that's what we do with the saliva test results. Other things that help along the way are critical, like controlled breathing. We got to start this slow. It's interesting that some people that have severe adrenal fatigue, they almost can't take in a full deep breath and exhale without it disturbing them. And you can see it when they shake, when they go to do it. So I say we start slow. We do a gentle 4-second inhalation with no pause, 4-second exhalation, and we do sets of 4. So 4 seconds in, 4 seconds out, 4 seconds in, 4 seconds out. We do 4 sets of those. The reason that we do the deep breathing is because it's really hard to get control of your fight or flight mechanism, your stress anxiety mechanism in your body, to pull it back down and stimulate the opposite part of your nervous system that pulls against that counteracts that fight or flight mechanism. But one way you can stimulate that to pull the fight or flight down is through controlled breathing. It really, really works. By getting control of your diaphragm and your lungs, makes a huge difference. Critical. Another critical thing, I could talk a long time about this, is the diet. We must have steady blood sugar across the board. And the way that we do that is we administer things called complex carbs. Simple sugars like a fruit like watermelon, or a Snickers bar or a donut, if you will. What those do is they cause a quick spike in blood sugar and a quick spike in insulin, and then a slam down of blood sugar and a slam down of insulin that can pull that cortisol all over the place and swing it around wildly, give that emotional stress and that instability that feels like anxiety. During the process of healing the adrenal glands and getting them back functioning normally, we must maintain steady blood sugar using complex carbohydrates. Things like quinoa and brown rice are perfect examples of complex carbs. They break down very slow and steady through the day. And what we want to do is make sure that the client who's trying to recover, the adrenal sufferer, who also has serious anxiety, that they have steady blood sugar through the day. So I call it the 6 golf balls. For breakfast, you want to eat 1 golf ball size of complex carbs, quinoa or brown rice. For lunch, 2 golf balls. For dinner, 3 golf balls. Some people wake up in the middle of the night at 3 and 4 o'clock in the morning all the time as their blood sugar crashes in the middle of the night and their cortisol wakes them up. Those people need to jump up real quick, and they need to eat a little protein, fat, and complex carbohydrate in the middle of the night. Along the way, to support the blood sugar, it's a great idea to use some precision supplementation containing chromium, cinnamon, alpha lipoic acid, and ginseng or green tea. One company called Metagenics, they make something called metaglycemics, and there's another company called Orthomolecular. They make something called diaxanol. Those are 2 great products that can help to stabilize the blood sugar. Be sure to consult your experienced functional medicine practitioner for what you need. Now, when it comes to exercise, this is really important. Exercising can crash the adrenals out. What we don't want to do is have setbacks. The adrenals, they're very, very sensitive, and the farther you are through the phases, the easier that they are to crash out. some people, they say, I wake up in the morning and I just grab my water bottle and I go and I run an exercise. I'm like, boy, that is just so rough and brutal on your adrenal glands. The rule is the worse you are, the worse that your test results show, the later you should exercise. But don't let it overstimulate you and don't overexert yourself. So someone that has advanced serious adrenal problems that crash out very easily, that after they exert themselves, they feel really bad. They feel really blown out. They feel woozy. That's that blood sugar dysregulation. Those people should exercise later in the day. But again, not so much to keep you up all night where it stimulates you. No overexertion. I want to take time now to talk about the phases of adrenal fatigue. Pretty simply put, phase 1 is called the resistance phase. That's where the cortisol output goes up really high as the body goes to fight against the chronic stress. Phase 2 is where some areas are high and some are low, and all of these things are demonstrated by those saliva tests. Pretty easy to read. Phase 3 is where things all go low, but there are 4 components to phase 3, 3A, 3B, 3C, and 3D. By the time you get to a 3D, you're really not getting up moving around too much. It's hard to sleep and it's hard to stay awake. Phase 4 is likely bedridden, and 5 is probably institutionalized, definitely on heavy-duty medications. But the point of that is to illustrate that the farther you are deep into your phases of adrenal dysfunction, the later on in the day you want to exercise. And I think pretty much anyone with any type of adrenal dysfunction should exercise later in the day, in the afternoon or the evening. Bedtime is critical too as well. You got to go to bed by 10 o'clock, even if you're laying there at night, and you got to get out of bed by 8 o'clock in the morning. Some people that work midnights or their sleep is just so often so messed up, we actually have them use a light box. There are boxes, they're anywhere $40, $50, $60 that just emit the light of the sun, and we have people get out of bed about 6:30, 7 o'clock in the morning and sit under these lights for about 30 minutes at a time. That can help to reset the blood sugar and the cortisol and what we call the circadian rhythms. Something that's really important, I just talked a lot about kind of the, critical part of, assessing things and trying to turn around them, get them on track. But what's really important is really figuring out why that a client got to that point anyway. And that's where holistic therapy comes in. There are specialized holistic therapists that focus on healing the old traumas and the old unprocessed anger and the goggles or the view, if you will, that we have on life and how we deal with problems and deal with stress. Sometimes we all don't get the best emotional education or experience, if you will, as we grow up or even into adulthood. Things like traumas, family separations, death, divorce, PTSD, physical traumas. These things can skew how we deal with stress, and it can burn these systems out like the adrenals and get us off track. The right holistic therapist can get to the root cause of why a client has gotten to this point, and then the scientific approach can help to physically turn them around in conjunction with some quality and consistent therapy. Consistency is critical. As far as time frame, how long does it take to get better from this? Some people start feeling better in a matter of days. Once they get on track, they start to stabilize their blood sugar. They start to feel better. Now, the total time to heal, 6 months minimum. It could be 12 months or more. Some people just kind of never heal. But being consistent is critical, and you can heal. I can tell you from personal experience, you can heal. This is coming from someone who was in a phase 3, C, or D, pretty advanced adrenal fatigue. Now, goals. What we want to create is a empowered and independent individual that uses food as medicine, and they use the proper exercise as medicine. They rely on complex carbohydrates and their coping mechanisms and their stress adaptation mechanisms that they learn from their holistic therapist. Independence is key. Empowering the individual to be truly independent, to take care of themselves, is critical. That's the ultimate goal. Anything short of that is unsatisfactory. So in summary, anxiety, it represents one of the most common and sometimes most difficult to treat conditions for a single therapist or clinician. And adrenal dysfunction is an unwelcome and stubborn condition that can hinder or halt recovery completely. But now, gratefully, an integrative, multidisciplinary approach is now available by applying basic functional medicine principles to time-tested counseling strategies administered by a caring therapist. I appreciate you taking time to learn more about anxiety and the accompanying adrenal fatigue and what to do about it. I'm Dr. Daniel Farkas, and I hope that you care for yourself, care for others around you, and use some great intention with a little bit of science to get the results for great health and mental and spiritual health that you want.